Well, hello, everybody. Dr. Ron Oberstein, president of Life West. Welcome to another edition of our Life Leadership Line. And today I have someone very special for you from outside of our profession, but someone who I've met just a short while ago, but I feel like we've known each other for years. You know, she knows about my family and I know about hers, and just a really wonderful person, Dr. Kristen Willeumier. And Dr. Kristen is a Ph.D. in the brain. I mean, she's doing amazing work in the brain, and she's been I'll give you her history. Just take a look at this, right? She graduated from Boston College in 1994. I do not detect a Boston accent on her. She went to UCLA, did her master's in, and at the same, she did her master's, and then from there, and that was on in the sciences. And then from there, in 1998 to 2007, she did a master's and a Ph.D. in neurobiology. And she got involved in brain research and started doing all kinds of work. Did her postdoctorate at Cedars-Sinai Hospital, right, in UCLA, over at UCLA in Westwood. And then she got called off, and she went down and became a celebrity with The Mole. If you remember the TV show The Mole, she went to South America in 2007 and was in the production of The Mole, and came back, and she became the director of research at the Amen Clinics. And Daniel Amen, if you know the work he's doing with amazing things with the brain. And then in 2016, she started doing independent work where she's doing research, she's a consultant, she's doing all kinds of cool things, and she's so holistically minded. She's been under chiropractic care for 20 years, understands that the body can regenerate itself and how the body heals. And when you hear her talk, you won't know the difference, but she's going to be giving us some great stuff. So Dr. Kristen, thank you for being with us today.
Oh, Dr. Ron, what a beautiful introduction. And it's truly an honor to be here with you today. Thank you for the invitation.
Absolutely. And I do want to let our viewers know, and we're going to put it on because, you know, Dr. Kristen just wrote a book, and it's it's unbelievable, called Biohacking Your Brain. We'll get that to you because I do want to talk about that as we go through our conversation. So, let's just talk about it. I mean, I know you've been under chiropractic care for 20 years. You understand chiropractic. You know, you understand the nervous system. Obviously, you're a PhD and a master's in neuroscience and everything else around that, and your first master's in the neurosciences. What do you see happening in brain research right now? You know, from the things you're watching with the Amen Clinic and what you're doing now.
Well, you know, one of my loves in the so what I did over at the Amen Clinics running their research department was utilizing brain spect imaging. We wanted to understand what happened with certain psychiatric disorders. There are these sort of neurobiological signals that we can see in the brain, and we can actually target and treat these disorders by understanding how the brain is functioning. So, you know, part of that is my love, and really following what happens in the brain with kids who play collision-based sports. I've done a lot of work in that area. So some of the latest research that's coming out in that arena, JAMA just published a study looking at football players, and they found, I think it was 600 football players, they found that they're getting more collision-based impacts in practice than during the regular season. And the kind of research that I'm really following is what kind of things can we do to help these athletes take better care of their brain, try to help, reduce the damage to the brain if they're going to participate in these collision-based sports. And then the other side of sort of the most novel research is what's going on in the brain of people who are infected with COVID. Yeah. And that's just a whole nother fascinating area of research, and, you know, looking at people who have infections. You know, is it getting into the brain? Yes, it is. It's getting in the cerebrospinal fluid. It's affecting certain areas in the brainstem. So right now, those are sort of the two areas that I'm focused on.
And, you know, it's interesting because, you know, and I know you did this, you know, you're with the Amen Clinics for such a long time. And if people, most of our viewers will know who Dr. Amen is. And if they don't know, I mean, he spoke at our conference called The Wave a few years back. And you're going to be speaking this year for 2021 at The Wave. But one of the things that when you go and you research him, you know, you'll see there's just this backlash from the medical community on the work that he's doing, right? On the scans and on the stuff. And, you know, and then when you listen to to Dr. Amen speak, he's talking about, well, we don't follow traditional psychiatry, right? We're not treating the symptoms out here. We want to get to the cause, which is a very chiropractic thing, right? We're about
Right.
the nervous system, the cause, and then you clear that up, and guess what? You get to the cause, there's no symptom, right? There's no effect.
There's no symptom, and you don't have to take the medication that's going to
Right. And especially in psychiatry, right? The medication, all the things that the psychotropic drugs, things like that.
Right.
I mean, you must have saw amazing changes happening in the brain.
Yeah, you know what was fascinating about working for Daniel, and I just love him. He's really a pioneer in the field of psychiatry. So the kind of people that would come into the Amen clinics typically had 3 to 4 psychiatric diagnoses. So ADHD, bipolar, depression. They were on an average of 5 to 6 medications, and they had previously failed 3 treatment providers. So we were like the last resort. And this is where we would use neuroimaging, whether it was using EEGs, right, a non-invasive way to look at the electrical activity of the brain, or the SPECT scans looking at blood flow and activity patterns. And we were able to use that to tailor the treatments to the patients. And what we realized is regular psychiatry is really just focused on addressing symptoms and then trying to guess at what medications work. The beauty of what we did was, number one, we were really focused on natural treatments, using nutraceuticals, using dietary and lifestyle modifications first. And then when those don't work, we would add on the medications in a very targeted way. And because as the director of research, I also was looking at patient outcomes, that was our goal. We would connect with patients at 3 months, 6 months, 12 months. How are you doing? How are these interventions working? And we had extraordinary outcomes. And I think why Daniel can be so polarizing the medical community is because he's actually helped to empower people to take better care of themselves through dietary and lifestyle modifications and using the nutraceuticals. And we would publish the research showing the efficacy of these nutraceuticals in literally changing brain function. And that's something I'll discuss more at the Wave.
Right.
Because I love the chiropractic community because I feel as if you can be the liaison for us, those of us who are in, working in the psychiatric field, to help people who are struggling and to help them utilize these, again, dietary and lifestyle modifications consistently to impact brain function.
Yeah, and it's so interesting because, we're doing some work at the college with, we're looking to bring a master's course out at the college in addictionology. And that's all brain-based, right? I mean, we have, he's actually a medical doctor and a chiropractor. His name is Dr. Jay Holder. He's out of Miami, and he's been doing this for years. And you look at it, and it's, there's behavioral things that are, of course, involved in this, but it's brain-based. And
addiction changes the brain, right? It changes the physiology of the brain. And that's why, when I get so concerned about young people nowadays who are still trying recreational drugs and ayahuasca and microdosing. And you try to teach people this can change the physiology of your brain and your brain structure, and you may not be able to go back to the way it once was. So I love that you're going to be incorporating this kind of curriculum and teaching people about this and what happens to the brain during addictions.
And it's interesting when you talk about that, because microdosing, things like that, the body, the brain, the body regenerates itself, and it's always trying to work for the positive, right? It's always trying to help itself. So therefore, it allows us to do more damage to it because we might not see it the first time or the second time. It's not like, if you touch that button on the computer, it's fried, so don't touch that button. No one's going to touch that button, right? But when it's like, it can correct itself and it can try to reorganize itself as the brain does, right? And
it compensates constantly.
It's always adapting.
When you're younger, I think that's why kids get into it, because the brain is always compensating. So you're not really feeling the effects of what you're doing. But trust me, you hit your 30s, 40s, and 50s, and your brain will show it.
Yeah.
And, that's what we want to prevent. We want to help lead the way
Yeah. And so that leads me to this, because, you wrote a book, and my prediction after seeing it, it's going to be a bestseller. It just is. And it's called, and we'll put it on the bottom for all of our viewers to look at and to go on Amazon to be able to find, but it's called Biohacking Your Brain, right? And this program isn't about this leadership line isn't just about promoting it, but I want to be able to call on that, because when you biohack your brain, it means that we know that the brain can change, right? We know that we can actually work with our brains. It's not like what you got is what you're stuck with.
Right.
You can do work with it. So what was your impetus to start this, and what have you found out about the brain since then? And, just that journey that you went on.
I love that. It's like, what is the why behind why I wrote the book? The why is, back in 2009, when I was with Daniel, we ran, at the time, was the world's largest brain imaging study in living professional football players. And this particular study had 100 players. And what we found is, using very simple dietary and lifestyle modifications for a 6-month period of time, we could change the actual physiological functioning of the brain as measured by neuroimaging. Now, we have more advanced technologies that we can use besides dietary and lifestyle modifications. But at that point, we didn't have a huge budget to be able to, run this full study. We just said, hey, we need to do things, and we need to empower the people that are in this particular study to take care of their own health. So I ran classes every week to teach these players how to do it. When you look at the follow-up scan 6 months later and see the changes, for me, it was extraordinary. It was actually life-changing. And it made me realize how powerful neuroimaging can be in inspiring people to make lifelong changes. So the book goes into the details of the things that I used to teach in the classes. And we use this as a model in our clinical setting to work with all of our patients, people with dementia and Alzheimer's disease, and people who were healthy functioning individuals, but just wanted to optimize their brain function. So the difference between my book and a lot of the books that are out there on brain health is it's experiential. Mm-hmm. And, at the Amen clinics, we would average 3,000 patients a month across all of our clinics. So it's not just data from one study. It's, what we've been practicing for years across thousands of patients. And for me, to be able to see that we can bring our blood flow to the brain, stabilize electrical activity, and we can do it through these simple lifestyle changes, not only was it extraordinary to me, but I'm thinking about your community, and you guys are the leaders. What I love about chiropractors is you see your patients consistently over decades, right? Somebody comes to you and they're your patient,
for life, hopefully, right?
And I almost feel like you are the best community to be taking this information and utilizing it. I mean, I'm just trying to take the guesswork out of it for people, because I'm a neuroscientist. I need to see the data. So this is very much data based. It's not my point of view. It's published research shows it, and we saw it again and again in the clinic. So whether I'm talking about it or Daniel's talking about it, and the conventional medical system probably doesn't want you to believe that it could be so easy. But one of the beautiful side effects we used to say from following this kind of program is you also lose weight. So it helped people get healthier and fitter, have a better brain.
Right. And it's interesting too, because I've got close friends. My wife and I took care of, we had a large fraction of the San Diego Chargers coming to us when we were in San Diego for a while.
Nice.
We became very close friends with a lot of these players. And one of my close friends, 14 years in the NFL, phenomenal all-pro player. I was visiting him because we were looking at doing some work with upper cervical work, brainstem work, yes. Right? At a clinic at an area that was doing stuff with people who had traumatic brain injuries, right? And
yes.
All players are part of that, right? With CTE and stuff like that, right? And by the way, Ben Anamalu, who the movie Concussion, Will Smith.
I know Bennett. Yeah, I published with him.
Oh, perfect. He spoke at the Wave, I want to say 3 or 4 years ago. He was incredible. And so, yes. But here's the interesting thing, Kristen. So I met with one of the heads of the NFL Players Association, right?
Yes.
And number one, they said they have a difficult time even finding their players because they kind of go off. But number two is people don't want to even get tested to see where their brain is at because they don't want to even.
They're afraid.
They're afraid. And it's so true. But when we can show pre and post studies of improved brain function. This is the stuff that needs to be able to get out so they can see, be able to see that, right? And be able to know that. And it's just,
this is why I'm excited to speak at the Wave, because I'll talk about that research. I'll show you the images. And part of why I wanted to write this book, there's 30 million children who are playing recreational sports in the United States. I think there's 6 million that are playing football. Part of this is also for the parents, who have those kids. And I know I keep going to collision-based sports, but yes, there's only a small number of people that ever make it to the NFL. I think there's 2,000 on a roster every year, and we take care of those players. The thing about those players is they're contending with neurodegenerative diseases, they've got 3 times the rate of the general population, but they're happening earlier, decades earlier. So a lot of the patients that I worked with 10 years ago are now coming down with Alzheimer's, ALS. I've gone to the funeral of one of our players, and it's serious and it's something that needs to be talked about, but I don't think we need to be afraid of it. I think we need to just empower the players with solutions. And truth be told, I will say this, every player should be going for chiropractic care.
Yeah.
100%. Absolutely. We would do that with the players who were in our studies. And I remember we sent them, there was somebody in Florida that was doing some kind of work at the same time we were. So I think this chiropractic care should just be a part of every NFL player's journey.
Yeah. And that's on a level of just making sure that because anytime you have a brain impact, we know you cannot have a head injury without having a neck injury. It just can't happen, right?
It not only can it not happen, and this is what I love about what Dr. Jackson is doing, studying what's going on at the level of the cervical spine. If, every time, the data is really fascinating with kids who are playing these collision-based sports. So there's I believe it was Wake Forest and Virginia Tech did a study looking at 300 kids, age 6 to 18. They put the HIT system on them, the accelerometers. So kids age 6 to 9 were taking impacts between 10 to 100 Gs, right? So that's that young developing brain, that neck that is not strong and stable. The average hit was 19 Gs. They were taking about 107 impacts in a season. Though and I've shared this with you, every time you take an impact to the head, it only takes 4.5 Gs of acceleration to be able to cause an injury to the spinal cord, like even just to the soft tissues. Mm-hmm. So nobody's really talking about that. We're so focused on the brain. And I think there's this beautiful space within the chiropractic field to get in there and establish sort of a standard of care and making chiropractic a standard of care. Because, if you've got kids from 6 to 9, having 100 impacts in a season, and you've got kids who play in high school averaging 600 impacts a season, and you've got kids who play Division I football getting 1,000 to 1,500 impacts a season. They need to have everything.
Yes, working. When you say those numbers, I shudder. It's kind of like, man, it's 9-year-old having that impact and the micro traumas that will accumulate throughout the years. It's like, it's just.
That's what's causing the anxiety, the depression, post-concussion symptoms that last for, a few weeks to years. I mean, everybody's like, kids can go back and play in 2 weeks. Well, when they would come into our clinic, because, we've scanned thousands of brains, not just the ones that, I'll talk to you about at the Wave, but most people's brains are not healthy.
Yeah.
And, I think that's something a lot of people don't know. And it's probably why people like Daniel and I are like, no, please take care of your brain now. But as you mentioned, the compensatory mechanisms, the brain is always trying to compensate and take care of you so you don't feel the symptoms, but it will catch up with you.
Yes. And the other part about that is when you talk about these kids and, let's talk about Dr. Jackson for a quick second, because Jackson, he was just on our show, I believe 2 weeks ago it was published just, before this. So Kevin Jackson's a good friend of mine. I've known him for 30 something years. His wife, Selena, his father-in-law, Jim Sigafus. And that's how we actually got to meet, because of this research that's going on. He put together a helmet, right? A Jackson Athletics, or at JacksonAthletic.com, not without an S. And you can go see the work that's going on there. And you've been involved in this research about, stopping the different compression forces on the football helmet and stuff like that.
It's like a tubing system that he created that connects the helmet to the shoulder pads to try to mitigate and absorb some of the impact. And what's beautiful about that, I think that a lot of kids who don't have the neck stabilization should have this sort of additional protective, what we call protective equipment. And he's really thinking about protecting the spine. And nobody in my field, nobody's talking about that. Like right now, we're just talking about, preventing concussions and, reducing the G-force. And I'll just tell you again, after seeing thousands of images and, working with hundreds of football players, the brain, every time it takes an impact, it's the sharing and tearing. As you talked about, the blood vessels and the axons and diffuse axonal injury, and DTI scans are showing it, SPECT scans are showing it. So it's happening. And I think people are actually aware and concerned. So the good part now is, well, if you're going to put a helmet on your head and play a collision-based sport, or, I'm a former equestrian, I've fallen off and I've had hundreds of impacts myself. So it could be cheerleading, wrestling, ice hockey, you could be a military veteran, any of that. The most empowering message I want to share with people, and, I'm sort of like Dr. Amon's number 2, back here, but you can change your brain, and it can change in extraordinary ways with the consistent following of healthy, lifestyle habits, and, going to get chiropractic care and taking the right nutraceuticals, and, following the appropriate, dietary and getting appropriate sleep. There's so much you can do. And if people don't believe me, it's measurable.
Yeah.
It's measurable.
And that's the amazing thing. And for those of you that are watching us, our listeners today and our viewers today, go back in the leadership line at lifewest.edu and listen to Dr. Jackson's leadership line, because it was really incredible. You'll learn more about the research we're doing. We're kind of running out of time, but I want to touch on something, because I want to really touch on your book. Because you wrote this book, Biohacking Your Brain, and you're talking about how we can make a difference, right? And what we can do, whether it's preventative, whether it's, and right now when we talk about contact sports, football is a big one. We know that. But like you said, hockey, how about volleyball? Women's volleyball is the number 1 concussion sport for women.
Soccer.
Yep.
Number 1 sport for women.
Soccer, yeah, exactly. And women's volleyball is next. There's all, because the forces aren't just being hit, it's jumping up and landing down, and what happens, and all these things that are going around on a repetitive level, right? So then you write this book. You came back in 2016 and said, I'm going to start doing something, and whatever. And you started your independent stuff, and then this book just came out, and I am telling everybody, I promise you, I'll put a quarter on any bet you want to put on that this will be a New York Times bestseller. Share with us, where the book came from, and just give us a insight into the book of what's going on.
Well, like I said, the whole reason why I wanted to write this book was from my work. I want to literally say it's like a love letter to my football players, because every chapter has a football story in it and also has a client story. And, I want to really thank Daniel Amen for, allowing me the opportunity to help lead this study. The reason why the book came out is I really got sort of intimately involved with the families and the players. I taught them every week how to take care of their brains and their bodies. And it went so well. Daniel said, I want you to teach this in the clinical setting to our psychiatric patients. So the book every chapter has stories. So it's very sort of connected. It's got all of the things that we have used in the clinical setting that were successful in helping patients get better. So it's like the formula that we use to take the guesswork out. And, I talk about teaching the Mediterranean diet to the players and why and how that worked. I mean, something as simple as that can slow neurodegenerative decline by 7.5 years. So there are certain things I don't think people realize or know, and I wanted to make sure all those nuggets are in there. So it's loaded with research, but it's really easy to read and, helpful to the clinician. And I'm hoping that you can use this as a comprehensive guide to always go back to.
Yeah, and to give your patients. I mean, obviously, something.
Oh, yeah, it's patient friendly too.
Exactly. Yeah,
that was the big goal. When working with HarperCollins, they wanted to make sure this is really accessible to people. So I wrote it in a way that was accessible to patients, but it has all the data for clinicians, and it's backed by the research we've done at the Amen clinics and other people's research. But it's a fun read. Like, I'm really proud of it. And I'm so honored that you're so gracious in giving, me the opportunity to share this. And
well, I think it's something people should read. And the other point about it is that as practicing doctors or practicing chiropractors, we need the resources to be able to give to people, right? And you got a practical book that shows you the how-tos and all that stuff. And then, it's like for us to change their lifestyle habits, it's much harder than for them to change it themselves. And they're always going to change it themselves anyways, but if they have resources to be able to do that, it empowers them. And that's really what our job is to empower them and make sure their nervous systems are functioning to the best of their ability. And we talked about like brain health. And when we do upper cervical work, we know that cerebral spinal fluid isn't just for bathing, it's for nourishing and regenerating the brain now. So that's what the research is showing. So we want to make sure this whole system is functioning well on a neurological level so people can reach their innate potential, whatever that is, right? Whatever their inborn potential is. But without our brain functioning well, we can have the clearest nervous system below the brain. And if the brain's not working well, so it's all one. And that's where we're coming from these days.
It's all one. And not to interrupt, but I guess I'm interrupting you. It's really funny because I do get chiropractic care, and just sort of before COVID, I was getting more work done on the shoulders and the neck. And we talked about that, the cerebrospinal fluid, if it can't flow, in the brain and out, you can't release the toxins, it can cause brain fog. I mean, I don't think people truly realize how valuable chiropractic work is. I'm such a fan and such a cheerleader. And if I, when I start working with football players again, I'm happy to create those.
Yeah. Well, we will create those liaisons, but I'm just excited. You're going to be at the Wave. We're doing research with you right now on the brain, things that we're doing, which we'll let out as this goes further. So we'll give people more information. And I think you've been published, 400 and something times or whatever. So
you can find me on PubMed.
It's such an extensive research. It's just so cool. So Dr. Kristen, thank you. Thank you for being with us today. And thank you for taking the time out of your busy day and for sharing your knowledge and sharing your gift. And I'm so excited, to have you at the Wave and have you at the college lecturing to our students. I'm going to try and sneak in at some point to say, you got to teach a class. And even if it's remote, you can do it remotely, right? We do an online class. So we'll talk about that later. But thank you. And to our viewers, thank you so much for being with us again for another Life West Leadership Line. We'll be back at you again in another couple of weeks, but every week we send something out, whether it's the Life West Leadership Line or whether it's the Life by Life West. So please join in, share it with your colleagues and friends. Tell people about Dr. Kristen's book, Biohacking Your Brain. Just go on Amazon and put that in there and you'll see it. And we'll put a link into it also that you'll be able to have. Remember, there it is right there so you can see what it looks like. Please keep sharing the love, keep taking care of your patients, doing everything you can to be the best that you can possibly be. And I look forward to being with you again in a few short weeks. So thanks a lot. And thank you, Dr. Kristen.